Good afternoon and welcome to our webinar, Housing Strategies to Help Address the Homelessness Crisis. My name is Melissa Keene and I will be your host and moderator for this afternoon's webinar. I'm a Senior Program Manager with the Institute for Local Government. A quick overview of today's agenda. We're just going to do a quick welcome and go through some logistics and background information, and then we're going to hear short presentations from each of our speakers this afternoon. That will be followed by a panel discussion and then audience Q&A, and we'll share some upcoming webinars with you and wrap up by 3:30. You've probably noticed that your line has been muted, and your line will remain muted for the duration of today's webinar, but that doesn't mean that you can't ask us questions. So you should see a questions box on the right-hand control panel of your screen. So please feel free to type in questions at any point during the webinar. We'll be monitoring those on the back end and responding as appropriate, and then putting the rest of those into a queue for our audience Q&A towards the end of today's webinar that I just mentioned. A little bit of background about ILG in case you're not familiar with us. We are the nonprofit training and education affiliate of the California Special Districts Association, the California State Association of Counties, and the League of California Cities. We provide practical and easy-to-use resources so that local agencies can effectively implement policies on the ground. We do this in a number of ways. We provide a lot of education and training, such as today's webinar. We also provide technical assistance and capacity building services for local agencies statewide. We also have a whole host of online resources that are free for folks like you on the line, so please check out our website if you haven't already. We have 4 main focus areas. We have programs focused on leadership and governance. So that's some of your state-mandated trainings around ethics and harassment prevention. We have a suite of resources for folks who are new to public service, and then focusing a lot in terms of effective governance teams and leadership skills and training and things like that in that space. We have a program focused on civics education and workforce. So that program is really focused on creating a pipeline to public service and helping facilitate municipal school partnerships and really just get young folks interested in local government as a career path. We have a program focused on public engagement. So that really covers a broad spectrum of things, from getting started to dealing with difficult meeting participants to helping embed public engagement into your local government operations. And we have a whole framework that local governments can adapt to their needs to really help authentically and proactively engage their community in a whole number of topics. And then lastly, we have a program focused on sustainable communities. And that program focuses a lot on housing and land use and planning and things like that, as well as energy efficiency, greenhouse gas reductions, sustainability best practices, and a number of other things for local jurisdictions. Want to quickly introduce our presenters today. So we have Lindsay Slama, who is a Senior Homelessness Policy Specialist with the Department of Housing and Community Development. Sherry Todoroff, who's the Interim Director of the Homelessness Initiative in Los Angeles County, and Megan Hunter, who's the Community Development Director with the City of Salinas. Before I jump in and let our panelists take it away, I just want to give a little bit of context about how ILG fits into this space and what we're doing in the world of housing right now. So we are part of the statewide Housing Technical Assistance Program with HCD and a number of other partners that are really working statewide to help provide resources and trainings and other technical assistance opportunities for local governments statewide. So we've been meeting regionally with folks and really trying to get a handle on what challenges you're facing, what barriers to housing development that you all have, and what resources and trainings would be most helpful to you moving forward. So we're part of that piece of this broader technical assistance program. In addition to that, we are working on an update to our Planning Commissioner's Handbook that will be released later this year. And then we'll be conducting corresponding regional trainings for planning commissioners kicking off in 2022. And then lastly, we're also hosting this series of webinars for local leaders across the state. This is the 7th webinar in the series. If you missed in the earlier ones, they are all recorded and posted on our website and cover things like equity and public engagement and things like that. So definitely check those out if you are interested. And then with that, I'm going to go ahead and turn it over to Lindsay, who's going to talk about the state's response to homelessness and some of the programs and funding opportunities available to you all. Lindsay?
Hi, everyone. I'm Lindsay Slama. I currently work for the Department of Housing and Community Development in our Housing Policy Development Division on homelessness policy. before my current position, I also worked at the Department of Social Services. I've also worked in permanent supportive housing before I came to the state, transitional housing, shelters, and such. So I'm glad to be here today. Next slide, please. So we wanted to start the conversation off with housing first. This is because it really is the overarching concept that impacts, us addressing homelessness. It took effect as state law in 2019, and really is a mind shift in how we house our unhoused individuals, and really meets the clients where they're at. It prioritizes based on risk and not first come, first serve, which used to be the original model, and really emphasizes the need for a strong coordinated entry system. Because of the risk and vulnerability, the need for voluntary but also quality services is essential to solving homelessness. And the two components of housing first include rapid rehousing, which encompasses really the majority of clients, and it really just focuses on, like the image shows, getting people into permanent housing as quickly as possible, and trying to eliminate the number of barriers from the traditional housing readiness model. The permanent supportive housing model is for those that are at the highest risk and highest vulnerability, and really is even more rich with services and support systems for those that are at highest risk. Next slide. So a big part of what's happening at the state involves the Homeless Coordinating and Financing Council. It's designed to develop policies, identify resources, benefits, and services to prevent and work toward ending homelessness in California. The purpose of it is to coordinate among state departments to streamline and create a cohesive cohesive way to address homelessness throughout the state among the various state departments. We have, I think, like 13 state departments that receive homelessness funding. So their job is to coordinate those efforts. They also have HEAP and HAP that you may be familiar with. HEAP, I believe, has now ended, and HAP, and I apologize for the acronyms. These are flexible sources of funding that HCFC administers to cities, the big cities, counties, and continuums of care, or COCs. They also enforce the Housing First Law, SB 1380, which also created the council. And they recently created the the action plan, I'm sorry, which is the strategic planning to address homelessness. They, as I said, implement and enforce Housing First Law, and then they have also working groups with state agencies to coordinate and collaborate. Next slide, please. So as I mentioned, the council, as I'll refer to it, created the action plan this year. They approved it in March. There's 5 action areas, 15 objectives, 101 specific activities for 13 state departments. So it's pretty comprehensive. And the state departments are required to report twice a year to the council with various quantitative and qualitative data. Next slide. So these are some new state laws that just passed, really, I think in like the last week, maybe two. The first one is AB 1220. The reason I said I'd refer to HCFC as the council is because this bill renames it to the California Interagency Council on Homelessness. It makes some other changes, like adding the Secretary of Health and Human Services Agency, adds other departments such as Department of Public Health, which obviously through COVID we've seen how significant that is and how needed that is. Then it mandates the state homelessness programs participate in council work groups, which is kind of happening already, but just really codifies that into law. But one really significant thing is that it removes the housing first exemption for emergency shelters. In SB 1380, there was this exemption for federally funded emergency shelters. Technically, they were not required to follow housing first, and so now this law removes that exemption. AB 977 also kind of just, I think a lot of this has already been happening, but just really codifies, like, you know, COCs need to share their data with the council for the new HDIS system. For statewide data, council staff must report fiscal data on all state-funded homelessness programs. Next slide. AB 27 has to do with youth. And I think there's another youth bill. I think it hasn't been signed yet. It is still in process. But it requires the local educational agencies to administer questionnaire, awards grant funding for 3 regional TA centers for homeless youth. So this is for youth in schools and to provide services and support those youth at school. AB 362 has to do with safety regulations. I think this is particularly relevant for this audience. Requires city and county enforcement over homeless shelters to report any violations, and you know, the city and county must follow up and then report any violation information each year to Housing and Community Development and our agency above us, Business Consumer Services and Housing Agency. Next slide. These are some highlighted programs that may be of interest. I tried to list those that I knew covered most jurisdictions and had the most significant amount of funding. Obviously, I'm most familiar with HCD's programs. Home Key Round 2, the application's up. We're doing pre-application consultations. The Emergency Rental Assistance Program. Really, this is really a preventative program to prevent evictions. No Place Like Home has been around for some time, and streamlining through AB 434 with, you know, HCD requirements, TCAC, and such, really streamlining that process, and preservation of affordable units. As I mentioned before, the HAP program, round 3, is in progress. The CalWorks Housing Support Program is for families on CalWorks that are experiencing homelessness, and is a pretty significant funding. I think every county receives funding through HSP. And the Housing Disability Advocacy Program for those clients potentially eligible for SSI. That program also is pretty significant, and also relates to the CalAIM program, which recently took effect and was converted from a pilot. Now it's a more permanent program. There's a few. Next slide. And so those were some of the programs. The council just last month created this document. This is a link. I'm not sure if the group's going to set up the PowerPoint, but this is a link at the bottom here to the document. And it provides, based on its various ways of looking at the information, which we'll see in the next slides, but based on what you need, it tells you how, eligible uses and such, and it's really comprehensive with state funding, federal funding. Next slide. So this page is the state funding, and so you can see some of the programs I mentioned. HAP is right here, and then the eligible use. So say you want to create a shelter, these are, the green is probably what you want to focus most on, right? The left column. The next slide is a different way of looking at the information. So it's by program, eligible activities, time frames, a little bit more detail. Next slide. And then this is just another way of looking at it. It's a 36-page document, but really, like I said, really comprehensive. I highly recommend it. Taking a look at it if you haven't. Next slide. The state has a lot of technical assistance for homelessness right now. Just in this last 6 months or so, a lot of programs have begun new TA programs. So each CD has had the first one, TA to improve delivery of homelessness systems, since early 2019. Currently, we're accepting requests for Housing First and Housing Stability. The ESG programs, CDBG and Home Key, all have TA. There's 4 areas for HCFC. One being, I know, racial equity. I think there's one on youth, a couple others. And CDSS, Department of Social Services, this year rolled out their TA program for FEMA reimbursement and room key, but they do also offer other types of TA. And they're also HUD TA providers on various topics and different levels of assistance that they provide. And I think that's my last slide.
It is perfect. Thank you so much, Lindsay. And I will definitely make sure to share that document in the follow-up email with everybody on the line here, so you guys can take a look at that with all of the different funding sources and eligible uses. That sounds like a very helpful document. So thank you so much, Lindsay. Just a quick reminder to all the folks on the line, definitely feel free to drop in any questions that you have as we go throughout these presentations, and we'll get to them a little bit later in today's webinar. But up next, I'm going to go ahead and turn it over to Cherie Todoroff with LA County. Cherie?
Thank you, and good afternoon, everybody. Yes, I'm Cherie Todoroff. I'm with the LA County Chief Executive Office, and I'm with the Homeless Initiative. Next slide, please. And just a high-level overview in LA County at our last point-in-time count, we had over 66,000 people experiencing homelessness. That's about 11% of the national total and just over 40% of the statewide total. Next, please. With our 66,000 people experiencing homelessness, just over 70% are unsheltered. And so the majority of the people in our county experiencing homelessness are unsheltered. And after having sort of a relatively level number of people experiencing homelessness earlier in the decade, in the last number of years, we have been seeing steadily increasing numbers each year when we do our homeless count. Next slide, please. So we have a severe sort of affordability issue in Los Angeles County. In LA County, renters need to earn just under $40 per hour in order to afford the average monthly asking rent of close to $2,000 per month. We have a housing gap of about 500,000 affordable housing units in order to meet the need here in LA County. Next slide, please. So the Homeless Initiative was created in Los Angeles County by our Board of Supervisors to become sort of the central overseer and director and evaluator of strategies to prevent and address homelessness throughout the county. And that includes a whole range of services. So it's prevention services, outreach, supportive services, interim housing, and permanent housing. And if we go to the next slide, I can give a little bit more information on how we created that. So the Homeless Initiative was created in the county in 2015. And initially, we went through a very robust and transparent and stakeholder-involved process of identifying strategies that we were going to focus on in order to address homelessness. And our Board of Supervisors approved $100 million in startup funding to begin to implement and operationalize those strategies. That was sort of a down payment, knowing that we needed ongoing funding. And so in 2017, voters in Los Angeles passed Measure H, which is a quarter-cent sales tax, and it creates about $355 million annually for us to fund our homeless services work. That sales tax, or that Measure H sales tax, is for 10 years, so it started in 2017 and it's set to expire in 2027. Next slide, please. So first I'm going to talk about, I'll spend a little bit more time on this slide and the next slide, talk a little bit about what we have done with our Measure H funding, and then talk about some of the projects that we have done with other types of funding. So Measure H allowed us to increase both the type and number of interim housing and permanent housing units. We have really focused our Measure H dollars on services, but strategically at a couple of points in time, those dollars have also been used for capital. And so initially, when we first launched Measure H a few years ago, we did create a capital funding pool. It was one time, those funds have been awarded, but that was used to create interim housing. So that was for construction and renovation to create more interim housing beds. And on an ongoing basis, we continue to fund operating costs for interim housing with our Measure H funding. And so, for example, in the current fiscal year, we're using Measure H about $150 million of Measure H to fund over 5,500 interim housing beds. And these are a whole range of beds from low acuity to high acuity beds. So they can start with just your basic shelter bed, where you have the bed and you have meals and some staff, all the way up to a bed for clients who have much higher acuity. We call them recuperative care beds. Often those are for people experiencing homelessness who are exiting a hospital. They've been there for a hospital stay, and we don't want them to exit to the streets. And so they exit to a recuperative care bed where we have on-site clinical support and lots of round-the-clock 24/7 support for clients. We're also supporting rapid rehousing with our Measure H dollars, and that includes the housing navigation, funding rental subsidies, and supportive services. As mentioned by the prior presenter, rapid rehousing is a type of housing for clients who are lower acuity and expected to need sort of shorter term support, maybe assistance, for 6 to 12 months with rental subsidy and services to get back in the employment market or to increase their income so that they can take over their rent. In the current fiscal year, we have allocated approximately $90 million for rapid rehousing. And over the course of the fiscal year, that could serve approximately 15,000 clients. And then permanent supportive housing is the housing for clients who are maybe chronically homeless, have really complex health and behavioral health conditions, have disabilities, and are expected to need long-term or even lifetime support. And with our Measure H dollars, we are funding housing navigation. We're doing some rental subsidy support with our Measure H dollar, but we're really focusing on maximizing federal subsidies. And then we're also funding supportive services in permanent supportive housing with our Measure H funding. LA County has made a commitment to fund supportive services for permanent supportive housing that's created countywide, whether that's project-based or scattered site. And so in the current fiscal year, the Measure H allocation for that is about $132 million, and it's supporting about 13,000 people in permanent supportive housing. And then lastly, we really wanted to make sure that we're maximizing our use of federal vouchers. And to do that, we are using Measure H funding for landlord incentives. So this would include things like incentives for leasing up with our clients, damage mitigation fund, and move-in assistance for clients, such as deposits and furniture. Anything that we can do to make the lease up of that federal voucher as streamlined and efficient as possible. And for our landlord incentive program, in the current fiscal year, we are funding that at about $11 million, and we expect that that will assist about 2,500 people. Next slide, please. And now I'm just going to talk about some of the other types of things that we're doing in Los Angeles County. And one of them is our flexible housing subsidy pool. This was created in 2014. It's operated by a nonprofit organization called Brilliant Corners, and it's operated through a contract with our County Department of Health Services. It kind of functions like a locally funded housing authority, and it provides locally funded rental subsidies for both project-based and scattered site housing, kind of similar to Section 8. Essentially, we know that only about 25% of people who are eligible for Section 8 actually receive it due to its sort of chronic underfunding. And so we do not have, like most jurisdictions, have sufficient Section 8 to be able to match that to our people in our community who are experiencing homelessness. So to supplement that, we did create the flexible housing subsidy pool. And what Brilliant Corners does is they engage with landlords to secure units, to negotiate participant leases, they issue the rental subsidy payments to landlords, they coordinate with service providers, and they provide tenancy support services. And one of the unique components of the Flex Pool, and something that has made it, has contributed so much to its success, is the high level of service that Brilliant Corners provides to landlords. So like the same way you have case managers who are working directly with clients in permanent supportive housing, Brilliant Corners has their housing coordinators who are there for the landlords and the property managers. So they're available 24/7 to respond to property owner concerns. They have a damage mitigation program. They step in to find solutions whenever there's any tenancy issues, et cetera. And that's been really helpful for us to be able to get access to properties that we may not previously been able to get access to. So through the Flex Pool, approximately 11,000 units have been leased up since its inception. Another program that we have here is our Interim Housing Capital Funding Pool. And this was created late in 2018 by our Board of Supervisors. They established a $50 million capital funding pool to support the development of interim housing, both new construction and renovation. And the capital funding, it's not going through our traditional sort of like public works, that sort of system in terms of doing the capital. What is unique about this is we're giving the funding to homeless services providers who may own or lease properties. And they are the ones who are then managing the construction. And the county is sort of protecting its financial investment, its capital investment by putting use restrictions on the properties. So it ensures that they'll be used for interim housing for a defined period of time, like typically that's 10 to 15 years. And right now that interim housing capital funding pool has supported the development of about 17 interim housing sites with over 1,100 beds. Project Room Key, which is something that we heard a little bit about, which has been very important in Los Angeles County. This is a non-congregate housing for people experiencing homelessness who are at increased risk for poorer COVID outcomes. This was, supported through the statewide program in LA County, through the county Room Key program. At our peak, we had lease agreements with about 33 Room Key sites. And we have been ramping down that program. And so right now we are planning to continue 2 sites through January. As of last month, we had served over 5,400 people in our Room Key sites. And we've really prioritized making sure that people are connected to a housing resource when they're in Room Keys so they do not exit to an unsheltered setting. So that has worked really well, although some clients do choose to exit and without accepting that housing resource. But the case managers work very hard with them. And to date, it's just over 3% who are exiting to unsheltered settings. We have an additional 5% who are exiting to unknown settings, so those could be sheltered or unsheltered, with the remaining going on into different types of housing situations. And then we have our Home Key program. So in Home Key 1, LA County acquired 10 hotel and motel properties with about 850 rooms. And one of those properties began immediately operating as permanent supportive housing because it had the kitchenettes. It was ready to be used as permanent housing. The 9 other properties are currently operating as interim housing, and once they're renovated, we'll convert them to permanent supportive housing. We are using project-based vouchers in these properties to support the operating dollars, and we're using our Measure H funding for the supportive services. In Home Key 2, we're actually looking to see if we're able to bring about 1,000 more units online, including both interim housing for families, TAY housing, and permanent supportive housing. And touching briefly on the American Rescue Plan, here in LA County, our Board of Supervisors approved an American Rescue spending plan, which included close to $470 million for housing and services for people experiencing homelessness. So this included capital funding for our Home Key 1 renovations, county contribution for Home Key 2 acquisition and renovation and operations, new construction of interim housing and permanent housing, and rental subsidies and housing navigation and supportive services for permanent housing, as well as funding for interim housing operations. And also, once again, to maximize our federal voucher opportunities, we're also using ARP funding to provide housing navigation and supportive services for our emergency housing voucher holder users as well. This particular ARP funding, I did get this question a lot, so I wanted to mention it. This is the fiscal recovery funds that came to look to jurisdictions. Many jurisdictions are using these funds for revenue loss. In LA County, we chose to use the funds to create and expand programs and services for vulnerable populations. And then lastly, I'll just touch quickly on the emergency housing vouchers. Approximately 6,800 of those were awarded to public housing authorities in Los Angeles County. We are using our coordinated entry system to match clients to the emergency housing vouchers. We're using this opportunity to match high acuity long stayers in our interim housing sites to permanent housing, which will then allow us to create flow through our interim housing sites and be able to provide more options for unsheltered people to come inside. And as I mentioned previously, we are using ARP funding to fund supportive services for clients matched to the emergency housing vouchers. In addition, we're using some of our Measure H funding as well. And we're using ESG funding for landlord incentives and damage mitigation and move-in assistance to also support the timely lease-up of these vouchers. We can go to the next slide now. And I'll finish up by mentioning that to date, in the first 4 fiscal years of Measure H, we've been able to place almost 72,000 people in permanent housing and over 92,000 people in interim housing. And just over 40% of those permanent housing placements and 57% of those interim housing placements were attributed to programs that were funded in whole or in part with that Measure H funding. So that is unique to Los Angeles, that we do have that quarter-cent sales tax. However, it has allowed us to heavily invest in programs and services for people in our communities who are experiencing homelessness.
Perfect. Thank you so much, Cherie. Look forward to hearing more from you during our discussion in just a few minutes. But with that, I'm going to turn it over to Megan Hunter with the City of Salinas to talk about their initiatives and programs. Megan?
Good afternoon, everyone. Thank you for having us. I'm going to try to be brief because I think it would be helpful to open it up to questions. So next slide, please. Just to give you a little bit of background information about the City of Salinas. The city is kind of in a unique position. We obviously have a significant population. We're over at least 156,000 people, but we're really impacted, and we really do have a lot of values that are tied to kind of rural communities. A lot of our community work in the agricultural industries, and so although we're the 33 largest city in California, we often feel much more akin to some of our rural communities. The economic driver, as I mentioned before, is agriculture. It's a $7 billion plus ag industry, and oftentimes Salinas is known as a salad bowl of the world. And I think the challenge is we're also right on the Central Coast. So we have some of the highest housing in California, but the incomes that many of our folks receive is much lower. So we have a very cost burden community. 50% of Salinas residents are considered cost burden, either paying 30 to 50% of their income at least minimum to housing. The community itself is predominantly Latino, almost 80%, and we have a very youthful population, which you know, also impacts our thinking around homelessness, because we have a lot of children who are dealing with homelessness or housing insecurity. The poverty rate is about 17%, but again, it doesn't really take into account the high cost of living in the city. And so sometimes when you're looking at those rates, it's not really capturing the true picture. We had a decline in our point in time count for homelessness in 2019. I'd like to say it was because we're doing a great job of housing individuals, but at the time that we did our point in time count, and this is the flaw with the point in time count, it was really bad weather. So I think people were particularly difficult to find the one day that we did the count. But we still have about 1,200 folks that we counted in our jurisdiction as homeless. At least 86% are unsheltered, so we have a very high unsheltered count. Our coordinated entry system, in the context that we see, really indicate the count is likely closer to more than 2,000, which is quite a substantial number given our population. Next slide. Next slide. So I just wanted to, these are images that sort of capture some of our challenges with homelessness. As I mentioned before, we have an extremely high rate of homelessness among families. Just to give you some context, Monterey County, based on some of the accounts that the school system has done, has found that 1 out of 10 children in Monterey County schools are homeless. Now, the homeless definition is a little bit different. It doesn't always mean homeless as unsheltered. It can also mean housing unstable. But what we're seeing is an increase, a steep increase in homelessness, street homelessness, or in this case, you can see in that image to the right, you know, family living in their car in our jurisdiction. It's really gotten bad. And in the past, we've been able to accommodate families because we've prioritized them in our shelters or navigation centers. We've been able to take advantage of that and put them into housing first. Now we don't. We have a waiting list for families who continue to be unsheltered. So that's something that we're really concerned about. We've also seen a pretty steep increase in homelessness among our seniors. And so that is a very concerning situation, particularly I think with the pandemic. We did take advantage, as LA County did, of Project Room Key, and we had a lot of folks that were seniors over 65. Because of the shelter in place that was put into effect during the pandemic, we had significant growth in our encampments. They became highly visible. They attracted perhaps people from outside the area. And there has been kind of this ongoing dynamic in the political dynamic in the city about what do you do about those encampments? Should you clean them up? Should you let them remain? Do we allow for sanctioned encampments? We haven't had a very good experience, I think, with some of the encampments. A lot of them have started off good, and I think we've had a lot of unsheltered folks who have been organized and have kind of maintained, but over time what has happened is a criminal element will creep in and really destabilize the encampments, and that's one of the pressures that we have to deal with, because I think the community itself has lost some tolerance for the shelter-in-place orders and the growth in safety concerns, trash accumulation, and fires. We also are challenged with, I think, some of the things that have been mentioned. We have hospitals that are actually releasing folks into homelessness, even though there's supposed to be a transition plan. So that's something that we as a jurisdiction are looking to working on more. And we have a lot of ex-offenders who don't qualify, or it's very, very difficult when you have such a low vacancy rate with housing. It's hard to get landlords to, even with incentives, to accept someone who's unsheltered. But add to that, if they're an ex-offender, it's really a huge challenge. So we see a lot of folks out on the streets who are ex-offenders. Next slide. So I wanted to talk a little bit about some of the successes that we've had. I have to say that the CARES Act funding has been so beneficial, and so has the HAP, or prior to that, the HEAP funding, in really galvanizing our communities to come together, especially better coordination and collaboration between the county, Monterey County, the city, and we have a continuum of care who is not the county government, but it's a nonprofit called the Coalition for Homeless Services Providers. And we've, I think that these opportunities have resulted in a really great collaboration. So firstly, you'll see the image to the left is what we call a Sprung Shelter, which is kind of modeled after the navigation centers that popped up in San Francisco. We put this navigation center in the equivalent of LA Skid Row, where all of the homeless were concentrated. For us, that community is called Chinatown. So we have been able to create some beds and really focus on exits to permanent housing in the area that we have the roughly, I would say, anywhere between 300 to 500 homeless individuals in just a very small, I think probably like nine blocks area. We also were successful in applying for Project Home Key funding, and we purchased the Goodnight Inn that's just below the Sprung structure to convert 101 units to permanent supportive housing. We actually partnered with an organization out of LA called Step Up, and we're really proud, and we're looking to doing more through Home Key. In the middle image, which is called the Share Center, the city and county partnered together. We had a warming shelter for many, many years. We partnered together to actually build a true navigation center with 100 plus shelter beds, emergency beds, and really working with a new organization for us is Bay Area Community Services, BACS, which came from Alameda, Oakland, to focus on permanent exits to housing. And we have really focused on empowering and working with those who are unsheltered. We've stepped up. The city got involved in actually doing street outreach. We started our own Salinas outreach and response team. We are working to with encampment leaders and integrating peer leads as part of our outreach team. So we're looking forward in hopefully the next few months to hire some part-time folks who are experiencing homelessness. And we also partnered with an organization called Downtown Streets Team, which has the same model of working with unsheltered folks and you know, having them help with cleanup efforts, but also providing housing support and or housing navigation and job navigation. And then finally, we have been really pushing for new kind of models of housing and looking at how we can really step up the creation of permanent supportive housing in our community. We recently opened a 90-unit permanent supportive housing project again in Chinatown, and more recently in the middle below you can see breaking ground on another smaller project for permanent supportive housing. Okay, next slide. So a couple of lessons learned for us is collaboration is key. In small communities, you don't have the resources that you might have as in larger cities. We did not get, I think if you're over 300,000, you might have gotten your own homeless funding if you were a jurisdiction. If you're not, you did not receive that. So really working closely together with not only the county, but also working with your COC, your continuum of care, and working really closely with nonprofit organizations. The other thing is we just recently undertook our Lead Me Home plan, which used to be a 10-year plan to address homelessness. We concurred that that's too long of a horizon, that we need urgent action now, and it has to be data driven. We have to make data driven decisions on funding. We are actually have a funding committee that collaborates and looks at how we can leverage our resources together to make things happen, and that's been really effective in getting things done for our jurisdiction. I think there's also a reality for us that many of our nonprofit organizations do not have capacity to do what we need them to do. And so it's really important to invest in capacity building and to encourage collaboration among the nonprofit sector. The other thing is we used to put up RFPs for folks without really clear directive on what our expectations were. And so we tended to fund the same activities based on outputs and not on outcomes, without really looking at performance or using data-driven information to drive what we need. We have changed that. We really are forcing and monitoring our organizations to perform better and looking at what they can accomplish, and rewarding people that have exits to permanent housing. For our jurisdiction, that adopting the housing first model was a real challenge to get people on board. So it was really important for us as the funders to make sure that that was fully being adopted and implemented. And then lastly, I think there's a real opportunity with the emergency vouchers, also with the ERAP funds, which is Emergency Rental Assistance Program, and ARPA funds, or the American Rescue Act funds, to really bridge those and put those together to leverage them. And so we're starting to do that, just like the county of Los Angeles. The city of Salinas actually allocated 25% of our 50 million, which is a little bit over 12.6 million for housing and homelessness funding. And we're looking at other leverages to really support the work, including our permanent local housing allocation. And for those who receive entitlement funds, there is additional funds through the American Rescue Act through HOME, which also could be leveraged. And so we as an entitlement jurisdiction, are receiving $3 million through HOME. So we're looking at how to braid these together to make a huge impact on both housing production and homelessness. That concludes my presentation. Thank you.
Great, thank you so much, Megan. Really appreciate you sharing some of your initiatives and programs with all of us. So hoping that everybody can come back together now. We're going to have some panel discussion, and then we've seen a few questions come in from the audience. Please definitely feel free to continue to drop those in as we go through some of the slide deck. Wanted to jump around there as we go through some of these questions and discussions. So to kick us off, we've talked about this a little bit already, but just curious to hear a little more from all of your perspectives. Obviously on the line with us today, we've got a city, a county, and the state. So it's pretty clear that this issue is not isolated into one jurisdiction's boundaries or even one county's boundaries or anything like that. So partnerships are obviously a key piece here, as Megan just alluded to in some of her remarks. So I'm just curious from everybody's perspective on the line here, what would your advice be to your local government colleagues that are looking to build those partnerships and create that collaborative space, whether it's with other local jurisdictions, whether it's with the state, whether it's with the CBO community or faith-based community? What advice do you have? And maybe Megan, you can kick us off since you were starting to talk through some of this already.
Yeah, I think the main thing is to look at homelessness as a regional issue and not to just think about it as your little geography, and really reach out to different jurisdictions and other stakeholders. The city of Salinas actually has a kind of unusual role because we administer emergency solutions grant funds for the region, as well as the California Emergency Housing Funds, CASH. And I think the city wasn't afraid to get in the fray of looking at things regionally, because no one was wanting to administer these regional funds because they're very they're very difficult. They take a lot of time and it's not a lot of funding. But actually what happened was the city decided that we didn't want to see the funding lost to the region, so we got involved, and it's been really great because I think it solidified our collaboration with other jurisdictions within the region. So I mean, that would be my advice. And of course we have the Lead Me Home plan, which is larger than just our jurisdiction, but is really a regional approach. So that's another way of getting involved. The city actually, through its ESG funding for the region, put money into it so that we could really ensure regional participation in the development of the
plan. Cherie, you're obviously in a little bit different position in a very large county, but can you talk about how partnerships or working with, whether it's your community organizations or things like that, have come into play in your work in this space?
Yeah, absolutely. And actually, I think the themes are the same, right? But coming at it from a different perspective, absolutely, like that regional approach, as well as that collaboration. From the very beginning of our work with the Homeless Initiative, and as a county, we're representing the 88 cities within our county. That Measure H tax that we're getting is coming from all of those cities. It would not be especially efficient or very viable for us to like carve up our homeless services system into 88 different components. So we have really looked at that regional approach. We have divided our county into 8 service planning areas. However, it's still very difficult. Like, we have to be very thoughtful about how we still balance the overall county approach to homelessness with each of these different sort of service planning areas, and then with all of our cities and all of their unique needs as well. We've had a really robust and transparent planning process and funding allocation process that we go through each year. And I think that's been really helpful for the voices of all of the different stakeholders to come up. And so we bring homeless services providers into that, people with lived experience, county departments, our COCs, business community, faith community, like everybody is invited to the table to be a part of helping to identify what the priorities were when we first worked on our initial set of strategies. We're going through a reevaluation process right now during our second 5 years of Measure H to get new input and to relook at those strategies and make refinements to them. Each year we go through a funding process with our Measure H dollars, in which we invite all of those stakeholders in to be a part of that process and have input into it. So I think it's really just, and a high level of accountability as well, with showing, making very public where that funding is going and how it's being allocated. So really it's the same things though, like really looking at all of our different communities, recognizing the uniqueness of them, but also having it be part of a bigger system and making sure that we're bringing all of the stakeholders into the process.
Yeah, I think that's a great approach for a lot of different subject matters that I'm sure the folks on the line are dealing with. That proactive engagement and getting the information out and that transparency can be so key to the success of a lot of these programs. Lindsay, I'm curious from your perspective, any suggestions on how local governments can maybe foster better relationships with the state or form that partnership with the state, since a lot of the funding comes through that way? Any thoughts there or tips for our local government colleagues?
Yeah, I agree with everything that Sheree and Megan mentioned. And just to add, I would say as much as you can, take advantage of any TA opportunities. I used to oversee my previous position, the TA program I mentioned, and we found that sometimes like people don't always know what they don't know. And so they come in with one thing, but then they actually need they come in with C, but they need A, B to get to C. And so I think but that also like builds that relationship with the state as well. So that's just one thing I would also add.
That's a great tip, and we'll make sure to get the information about the programs that Lindsay mentioned out to you all. But is there a good place for folks to find those opportunities? Is it all listed on HCD's website, or is there somewhere else, or a listserv type situation that folks can hook into to know about those opportunities?
I might have to get something to you. It's sort of by, different department. I don't know if there's one comprehensive list of TA out there, but yeah, I could try and look and get you something.
Well, in the meantime, we can definitely share all of the ones that you mentioned on the call today. But if you come across any place that they're kind of aggregated, I'm sure that would be a helpful tool for folks on the line.
Definitely.
So we've got a couple of questions related to kind of the balance between proactively keeping folks housed and then the services for folks experiencing homelessness. There was a mention of, obviously, you've made some really incredible strides, Sheree, in LA County of getting folks housed, but yet the numbers of unsheltered folks seem to be rising. So how are you balancing those two kind of seemingly competing priorities, probably from a funding perspective at least, but how are you guys balancing that in your jurisdictions between the proactively keeping folks housed and then also providing services for the unsheltered?
Yeah, so just as it relates to serving people experiencing homelessness, we have been having a lot of conversation recently about, quite honestly, how our system is not very balanced. We have a very large interim housing system. We have about 25,000 beds. We have very robust outreach. We certainly have a lot of permanent housing exits, but we don't have the right number of permanent housing exits that we need to really have flow through our homeless services system. So we've done some analysis here in LA, and we think ideally, so that people would flow, quickly exit, unsheltered homelessness into sheltered settings and then move into permanent housing, that we ideally would have, for every one interim housing bed, we would have 5, permanent housing exits. And where we're at right now is more like 1-to-1. What that means are people are staying in our shelters for long periods of time. Like ideally, you don't have somebody staying in interim housing for more than a few months, but we have residents who are staying, for a year or even longer. So our interim housing beds are not turning over the way that we would like, which then, of course, leaves fewer beds for people who are unsheltered as well. So we're really having lots of conversations about how to create that flow through our homeless services system, and quite honestly, how we really need to be focusing on those permanent housing exits. It's very sort of easy when you're looking at homeless services to say, if we only had more outreach and if we only had more shelter, we would have like a solution to homelessness. And actually, those are not the things that solve homelessness, right? It's housing that solves homelessness. And you can have more outreach teams, but if they don't have any beds to put anybody into, then your streets aren't going to look any different. We could have more interim housing, but quite honestly, for most of us, we have learned that interim housing costs more to operate than actually helping people get into permanent housing. And interim housing doesn't mean that somebody's not homeless anymore, because they're still homeless. So we're having lots of conversations about that flow through our system and really focusing on the permanent housing exits and getting there more quickly. Of course, very much challenged by the shortage of rental subsidies and the shortage of affordable housing, which is what we're all struggling with. We also have just that big balance, as you're talking about, between prevention and helping people who are currently experiencing homelessness. And our homeless services system just touches a piece of that prevention pie, right? It's just a slice of it. Like usually homeless services is just hitting a few people right at the point of imminent homelessness, with maybe some financial assistance to keep them in their housing. And even the homeless services system doesn't have enough funding to help everybody in that situation. Prevention ultimately is really, downstream, and it's usually not the homeless services system. And we're talking about really big, issues as it relates to, poverty and education and living wages and affordable housing and systemic racism and all of those things that feed into homelessness. That inflow into homelessness is not something that the homeless services system has much control over, but where a lot of folks are turning right now for the solution. So I think a lot of homeless services systems across, the state and the county are struggling with that right now, especially during the pandemic, as unsheltered homelessness has become so much more visible and encampments have become so much more visible. And everybody's looking toward a particular system to have all of the solutions, where really it's much broader than that, and many different sectors of government and the public and private sector need to come together on the solutions.
Muted here. Hi, sorry. No, that's a very good point. Obviously, that's one of the huge challenges in working on this issue is there's no one path in, no one path out. So there's so many compounding factors that are controlled by so many different parts of your local jurisdiction or the state, and trying to get that all coordinated and move together in kind of lockstep is definitely a huge challenge. So I appreciate your thoughts on that. Megan, anything from your perspective to add in terms of that balance between preventative services and services for your unsheltered?
Yeah, I agree with Cherie. I would say one thing that I think there's a tremendous opportunity with ERAP to actually assist folks. These are probably vulnerable people anyhow, and building a list and building relationships with those individuals now might pay dividends later, because these are probably going to be the same vulnerable people that maybe 2 years from now or a year from now, they'll get this influx of cash. But then when the cash dries up, they're going to kind of be in the same boat. So it's really important, I think, to start building those relationships and seeing how you can maybe do and look at more homeless prevention opportunities, because you could house every person in the system today, but if you're not stopping the door from opening up to letting more folks in, you're not getting anywhere. So it's really important to stop the flow from people coming into the system, and then really focusing on how you can address the people that are within the system. And I know for us, it's a little bit easier in a smaller jurisdiction. We have essentially we have 2 navigation centers and a domestic violence shelter. And so we're putting a lot of funding into rapid rehousing, focusing on those navigation centers, because I think as Cherie indicated, if people are staying there for a year, you're not helping people who are unhoused get stabilized and get into the system. So we're looking at ways that we can have more exits to permanent housing, and that we can look at our data, and we have goals set up to reducing stay time to 90 days. The other thing is, I think the longer people are in a shelter or emergency site type situation, it's harder for them to make that jump, because they've gotten some comfortability in that system. It's harder for them to jump into a permanent housing situation. So I think it's an incentive to try to get people out as quickly as possible and stabilize, and that will help with mental stability and economic stability. The one nice thing about the whole Project Room Key / Project Home Key is getting those people, chronically homeless people with major mental health issues and health issues, off the street quickly, really demonstrated to us how important a housing first model is, because it's really helped stabilize them on the service side too. And then finally, I think you definitely, when you're thinking about chronically homeless, you need to have wraparound services in your permanent housing, because a lot of people, sometimes permanent supportive housing is not supportive enough, and people fall out of that system. So you really have to be critical about retention rates and making sure that those folks aren't getting housed and then falling back into homelessness.
Yeah, great. Thank you so much. Appreciate your thoughts on that. We've received a few questions on the emergency vouchers. So the first question is how can folks access those? Can any of you speak to kind of the road into accessing those vouchers?
Yeah, I'm pretty sure, but maybe someone knows more than I do. But we're working with our continuum of care, and I know it's tied to the CAR system, and we're working kind of hand in hand. They, in our jurisdiction, although I think the Housing Authority is part of the process, it's really the continuum of care that is really helping prioritize who receives those vouchers. It may be different in LA County, but that's how it's working for us.
Yeah, and it's the same in Los Angeles County as well, the continuum of care and doing that matching to our coordinated entry system. So that would be, the way to access those. But I would just say more broadly, like for anybody experiencing homelessness, at least in LA, getting that connection to the coordinated entry system, getting that assessment of acuity, is the way to get matched to any housing resource, whether it be the emergency housing vouchers or other types of federal vouchers, or even the local ones that I was talking about. So that would be the pathway in Los Angeles.
And one thing that we're doing, and again, I'm really thrilled that the city actually has a little outreach team, because it's been so nimble and great. And now we have our outreach team like 100% focused on getting people in the system and really focus on connecting them to those emergency vouchers. That's what we're doing in the encampments right now, because it's a great opportunity.
So related to that, any other lessons learned or what's working in terms of your process with the vouchers? Obviously, Megan, you just mentioned your outreach team and how instrumental that group has been. But Cherie or Megan, anything else you want to share in terms of what you're learning through this process or what's going well?
Yeah, so we're looking at these. So once they are being matched through our coordinated entry system and with our COC, they don't come with the types of services that like you would traditionally need to like make them permanent supportive housing. So we've had to match those on our own. And so we have, in the short term, we're using some of our ARP funding to fund those services. We're also using some Measure H dollars. We'll have to come in with some ongoing funding, because to the extent the ones that we're using for permanent supportive housing, there'll be long-term supports that are needed that, that's been mentioned. We're also, just because we have this issue with turnover in our interim housing beds, as sort of like a practice for us in Los Angeles, we're also looking to really have this be an opportunity to move some of our highest acuity folks who have been in interim housing for extended periods of time. They haven't been matched to a housing resource yet, to match them to these emergency housing vouchers as a way to help people move to interim housing and once again, like open up that flow. So one, I mean, it's we can create the best sort of shelter systems with the most amazing providers, but it's very, very difficult to live in that type of setting for an extended period of time. It's very difficult for physical health and mental health and emotional health. And so like everything that we can to move people out as quickly as possible is going to help people on the journey back into housing stability. But we also just need those beds because we need to help unsheltered people come inside. So that's the way we've been targeting some of our emergency housing vouchers, is to help with that flow to interim housing.
And I'd just say become really good friends with your COC, as we have. I talked to the executive director of the Coalition for Homeless Services Providers almost every day. So just make friends.
It goes back to that collaboration and partnerships piece, right? Making sure that you're connected to the other folks working on this issue in your community. And I've definitely heard that from other jurisdictions as well, that the COC is a great resource to get hooked into and make sure that you know those folks. So a few other questions coming in here. We got one question related to unemployment. Do any of you guys know any data or anybody looking into a connection between unemployment and homeless numbers in the state or in your communities?
Yeah, we do look at it, and we look at kind of that connection, but we're actually finding in our community, we have a lot of the people that are unsheltered are actually employed. So I would say that we have a lot of underemployed folks. And then we have the unique situation in that a certain number of months during the year, the ag work dries out, and then, people sometimes will slip into homelessness because they can't afford the rent, and the income that they make during the 9 or 10 months that they're working is just enough to get them a housing. So we are looking at that, and we are looking at also assistance and homelessness, and making sure that people who are unsheltered we have also a challenge that people who are unsheltered don't always have the support. They're not always receiving SSI, and we, work to see how we can get them signed up.
Yeah, I would say our situation is probably a little bit different. If this is part of that sort of difference between a smaller community and a more urban one or a more rural one. I think a significant percentage of people experiencing homelessness in Los Angeles are unemployed. Although there are definitely some who are employed and also homeless. And we're all, I think everybody is once again, the state and national level is just like waiting to see what happens as we move through the pandemic, as sectors open up, as eviction moratoriums lift, like what the impact is going to be on employment and housing stability, and what that potential then inflow into homelessness could be as a result of all of these shifts. So I think there's been some information that's become available that we've all have seen with a high level of concern, indicating that we could be seeing a wave of evictions and a wave of people falling into homelessness. And once again, like for us, and I know everybody is thinking about it, and certainly, our electeds are, and they're putting a lot of effort and resources into it, but there's such a vast difference between what it takes to help somebody stay in the housing that they have versus how much work and how much cost is associated with helping somebody after they've already become homeless. And it is so much more cost effective to help people stay in the housing that they're in. And we just need to continue to really focus on and develop that area much more than we have so far. And I just say that because stopping that inflow into homelessness is the way that we change homelessness. In LA, we have, on average, we're helping people exit homelessness. 207 people every day exit homelessness, 227 fall into it. Like every day we're falling further behind. We have to stop that front door in order to be able to ever address homelessness.
And I was going to mention the point in time count. This is really a good resource for data for your your homeless population in your community. And I think, because of the pandemic, many jurisdictions or many COCs weren't able to do their PIT counts. I think you're mandated now to do it this coming year, so we'll be an off year, but get involved. And we got involved in helping with the count, getting volunteers, and it was really important, I think, for us to understand that. But there's a lot of rich data that we use to actually target some of our resources a little bit better to understand who's falling into homelessness, and that's a great resource.
And related to that, annually HUD so on a federal level puts a report out to Congress on homelessness, has the point in time counts and some of that data that might be helpful to everybody on the line as well. Lindsay, from that perspective, is there any data from the state that might be helpful to folks as they're trying to assess their homeless populations and things like that?
Yeah, so I was just going to say, the point in time count, I mean, we know it has its limitations, right? But the good thing it has is that it captures the chronically unsheltered individuals. But the benefit of the new HDIS system that the council has initiated this year which collects data from HMIS locally, has shown quite a difference when looking at youth and family homelessness. Those numbers are significantly higher when you compare with the PIC count. And so I think using both data sets are really important for different reasons, different populations. The youth and families are, tend to be more likely to be doubled up. They're not going to be captured in the PIC count, right? And so they're going to be captured in the HMIS or other services and such. And so those are just some of the differences that I've seen. Yeah.
No, that's helpful. Thank you. And we can share links out to some of this with you folks on the line as well, in terms of where you can find those annual reports and things like that as a starting point. Just checking out our time here. We've got time for maybe one or two more questions. So Sheree, I think you just alluded to this a little bit, but as everybody I'm sure on the line knows, that this can become a very politically charged topic of conversation, both with your community and a lot of different things there. So any thoughts on how your jurisdictions are really navigating the political reality of it? So your council or board, how are you having those conversations with your community? Any tips on how to navigate this successfully for the folks on the line? Sheree, do you want to maybe jump in there, since you have already alluded to this a little?
I would love some tips. No, it is. It's a really, really difficult time. I mean, homelessness, we have been experiencing increases, but during the pandemic, unsheltered homelessness has become so visible. The growth of encampments, it's being experienced in communities throughout our county, every community essentially, and in places where it hadn't previously been experienced. And I think now, as we're coming to this point in the pandemic, and communities are trying to go back to what feels like normal operations for them, and we have 88 cities, and all of the constituents in those cities are talking to their elected officials about what a priority homelessness is for them. Those elected officials are, raising that to, the Board of Supervisors who represent them. There's a really high level of frustration right now, and it's understandable. It's like untenable that we have so many people who are homeless, and it also is having tremendous impact on all of our neighborhoods and all of our communities and businesses as well. So we're just, we're being responsive to that by one, I sort of listed a number of the investments that LA County is making, and we have chosen, and our Board of Supervisors has chosen funding initiatives that address homelessness as one of their priorities, and has made significant investments in that, not in addition to the funding that's coming in from the state and federal levels, but also local dollars as well. And so we are increasing interim housing. We are continue to grow permanent supportive housing. We have committed to our cities that if you create permanent housing in your cities, then we will fund the supportive services to help make those sites really effective as permanent housing and create housing stability. We have started a process that I mentioned quickly, which is offering the opportunity once again for all of those stakeholders to come in and give their input about how we're doing with the funding that we receive from the sales tax and that we're using across the county. What would you like us to do differently with it? So we're creating that opportunity to have input into that. And then also our Board of Supervisors has created a Blue Ribbon Commission on Homelessness, and specifically what they're doing is looking at the governance of homelessness within our county. It is pretty complex with that many cities and with the county. We have a couple different COCs. One COC, LASA, that covers the vast majority of the county. So we're just having those conversations very publicly right now about how can we improve our system and the way we manage it in order to have the greatest impact.
That's great. I think going back to some of your comments earlier, again, being proactive, having that transparency and those conversations with your community and just keeping that line of dialogue open, which is obviously easier said than done and can definitely be a challenge for the staff that have to be that intermediary sometimes, but can definitely pay dividends in the long run. Megan, anything from your perspective you want to add there?
Yeah, I was just going to say education is key, and don't assume that people don't understand. Kind of get out of the slang that we love to use as government folks, but talk in plain language and explain and use data to drive your point. I think data is really helpful. And then to any folks out there who are elected officials, sometimes you have to make the hard choice. Sometimes you have to make the hard decision, and success is going to be, vindicate you when you're, sitting there at the moment and everyone's really angry at you. We had it was very controversial when we were building this brand new what people thought is a homeless shelter in a very pretty nice neighborhood in our jurisdiction, not too far away. And boy, we went through some really heated times, and we got yelled at by all sorts of folks. And I have to say that the politicians stood together despite it being a very controversial decision. And now we don't hear a peep. It's open, it's functioning. I have not had a single complaint. It's been open for since June. So, it just goes to show you that sometimes, when you're successful, it really changes the dynamics. So don't be afraid to make some of those tough choices.
I appreciate that comment as well. Got one hopefully quick question here about funding sources. Any suggestions on good funding sources or applicable funding sources for rapid rehousing programs?
ESG is a good one. And also, I think the CASH, which is California Emergency Solutions and Housing Grant, we've used those funds. Also, I think you might be able to use some of your permanent local housing allocation, but I guess that might be a question for Lindsay, if you can use some of those dollars for that.
Actually, I'm not sure, but I was going to say HAP is another large source of funding that's good for rapid rehousing.
Yeah, absolutely. I forgot about HAP.
And I have the same, like ESG and HAP, and then we have that unique situation of having our Measure H sales tax, which we're also using for rapid rehousing.
And I was going to mention, I think you could probably use your American Rescue Plan dollars too. Take a look at that.
Okay, just a couple of closing things here. Want to share that we have one more webinar in this series coming up. Since we're closing out the legislative session, we're going to be hosting one final webinar in November on some of the new laws and new funding that is coming down from the state for housing programs and initiatives and things like that. So stay tuned for more registration information on that front. Just how you can stay connected with us at ILG. And then I'm going to put up everybody's contact information here while we close everything out for the last couple of minutes. And I apologize for the sirens on my end. But I am hoping that, downtown living. I'm hoping that each one of the panelists will humor me a little bit here and respond to one final quick question as we close everything out. So I'm guessing that some of the folks on the line might be a little bit newer to this subject matter. So just hoping each one of you would share maybe one piece of advice that you wish you had known or that you would like to share with your colleagues that are getting started in this space. Cherie, can I start with you? Any piece of advice or anything you wish you'd known before you started your career in homelessness initiatives?
Oh, such a big question. I think probably themes that we've already been talking about. One, just how important it is to have those conversations and have them often, and to take every opportunity to educate and inform and to come with the data. That's just so impactful. And then also just these really inclusive, planning processes that invite all of the stakeholders in, because there's so many different parts of our society that are impacted by homelessness.
Thank you. Lindsay, anything to share from the state's perspective? Anything you wish you'd known or any advice you'd share?
Yeah, I'd agree with Cherie, and just the importance of relationships and really working collaboratively, like I think we've kind of been talking about. Those are hugely important.
Megan, you want to close us out? Any advice you'd have for folks?
Yeah, don't be afraid to get involved or question, even if you know nothing. Sometimes people that are in the thick of it, they can't see the forest for the trees. And sometimes it takes an outside perspective to say, why are we doing things like this, to really shake up the system? So don't think that you have to, educate yourself to question or to ask questions or to give out some good suggestions, because that sometimes is the best suggestions come from people who have no knowledge. So don't be afraid to get involved.
Great. Thank you so much for that. And thank you for all of your comments and your experience and all of the lessons learned that you've shared with us today. So with that, I want to thank the audience for joining us this afternoon. And thank you, Cherie, Lindsay, Megan, for, again, sharing your expertise and spending your afternoon with us. And with that, I will close everything out. And so just thank you so much.
Thank you. It was nice to meet all of you.
You too.